Welcome to Crash Course with junior researcher Maddie Thompson. Today we will be talking about embryonic genetic treatments. Let's start off with what is an embryo? An embryo is the beginning stages of life after the fertilization of the female egg by a male sperm cell. This is the initial stage of development for a multicellular organism, usually a mammal, an organism that reproduces sexually, like humans. What are genes? Genes are a sequence in the DNA. This is the basic unit of inheritance. Genes are passed from parents to offspring and contain the information needed to specify physical and biological traits. Genetic treatment in embryos is altering genes in an embryo with a high probability of genetic disorders such as cystic fibrosis, Down syndrome, sickle cell disease, and Huntington disease. Genetic disorders are diseases, conditions, or traits caused by abnormalities in an individual's DNA. Embryonic genetic treatment is sometimes referred to as pre-implantation genetic diagnosis or pre-implantation genetic testing when used in the context of IVF, in vitro fertilization. IVF allows genetic testing of embryos before implantation. It allows the patient and doctor to prevent certain genetic diseases or disorders from being passed on to the offspring. First, in IVF, the egg cells from the mother and the sperm cells from the father are harvested. Embryos develop into a blastocyst, which is then biopsied and genetically tested. The cells are studied for gene markers or mutations known to cause genetic disorders. These can include single gene disorders or to choose the embryo with the highest implantation potential to reduce the risk of miscarriages. Let's talk a little about the history. The first IVF baby was Louise Brown, who was born in 1978. In the early 1980s, mouse ES cells were isolated and scientists were able to use them as a vehicle to introduce targeted gene modifications. Human ES cells were then isolated and found to have great potential applications in regenerative medicine. Scientific advances in reproductive biology have made numerous advances since the creation of somatic cell nuclear transfer, SCNT, in the 1990s. SCNT demonstrates the possibility of embryogenesis without the fertilization of two opposite sex gametes. Researchers have bred a successful generation of mice by merging two oocytes in the absence of sperm. This would be life-changing for lesbian couples wanting to have biological children. In 1973, under the decision of Roe v. Wade, the government refused to fund embryo research. This pushed all embryo research into an unregulated private sector where treatments such as IVF were worked to created. President Bush in 2001 became the first to allocate money to embryo research. The government had banned research on embryos before, so half of the research that we have now was from the private sector, whereas since 2001, the government has funded some research. It makes it difficult for the government to fund this research because there are two cultural factors that affect the U.S.'s views on embryos. The U.S. has a large church-going religious population who have concerns over gene modification and gene testing, and the U.S. has a politically active anti-abortion debate, and abortion and embryo genetic treatment are tied closely together. In the early months of 2024, this year, the Alabama Supreme Court decided frozen embryos should be considered as children in the eye of the law, and that those who destroy the embryos should be liable for the embryo's quote-unquote death. The destruction of embryos falls under the state's wrongful death of a minor law. A fetus diagnosed with Pompei's disease recently was given a bone marrow stem cell transplant and showed tremendous postnatal outcome. Also recently, pre-implantation genetic testing has developed as an alternative to prenatal genetic tests. It allows couples to avoid pregnancies with abnormal chromosomes that would end with the subsequent termination of the fetus. It was originally used to detect early onset monogenetic conditions, but is now used to prevent various types of inherited cancer conditions. Research on the early human embryo has long been recognized as essential to progress in many biomedical areas, from reproductive medicine to the treatment of cancer in the pediatric field. With the new possibility of stem cell research and cell replacement theories, embryo research holds out the promise of cures for many serious diseases, such as diabetes and Alzheimer's. Scientists are researching many aspects of embryonic genetic treatment, including how effective is treatment in correcting genetic abnormalities in embryos. And do we have the ability to remove genes from the human population once enough humans without the carrier and dominant traits have reproduced? What are the potential long-term side effects of genetic manipulation on the health and development of the embryo and subsequent baby? What regulatory frameworks should be established to govern the use of embryonic genetic treatment and ensure responsible research and application? Pre-implantation genetic screening is increasingly being used to detect numerous chromosomal abnormalities in embryos to improve implantation and success rates after in vitro fertilization. The main reasons that pre-implantation genetic screening is done is if the age is of the maternal age, if the mother is too old, if there has been repeated implantation failure, or if there is recurrent pregnancy loss. Recent technological developments allow for a nearly complete replacement of the cytoplasm in embryo, which would eliminate the transmission of undesired defective mitochondria, the mutated mitochondrial DNA, for patients with inherited mitochondrial diseases. This is called mitochondrial replacement theory. Now, let's get into the pros and the cons. There are many pros and cons of embryonic genetic treatment. There are many people on both sides of the debate. It is subject to much ethical consideration. Some of the pros include the prevention of genetic diseases. Embryonic genetic treatments offer the potential to prevent genetic disorders and hereditary diseases by correcting or eliminating faulty genes before birth. There is also an improved health outcome by targeting genetic abnormalities early in development. Embryonic genetic treatments could lead to improved health outcomes for individuals and possibly for future generations. There is also an enhanced understanding of genetics discovered when researching genetic embryonic treatment. It contributes to a better understanding of human genetics and developmental biology, which could have broader implications for medical science. And lastly, personalized medicine. Advances in embryonic genetic treatments may pave the way for personalized medicine, specifically tailored to individual genetic makeup, potentially improving treatment efficiency and reducing adverse effects. Opposition to embryonic genetic treatments can come from various sources, including religious groups, ethicists concerned about the potential misuse or unintended consequences of altering human embryos, and individuals who hold personal beliefs about the sanctity of human life or the natural order of reproduction. Additionally, some people may have concerns about the implications of genetic manipulation for societal norms, equality, and the potential for creating designer babies, a concept elaborated on in the 1997 film Gattaca, directed by Andrew Niccol. Some of the cons are the ethical considerations. Manipulating human embryos raises ethical considerations regarding the moral status of embryos. The potential for unintended consequences is huge. As mentioned, the slippery slope to designer babies, as well as social justice and equity. Access to embryo genetic treatments could exacerbate existing social inequalities, as it may be limited to those who can afford it, widening the gap between privileged and marginalized, as well as many unknown long-term side effects. Research on the early human embryo has long been recognized as essential to progress in many biomedical areas, from reproductive medicine to the treatment of cancer in the pediatric field. With the new possibility of stem cell research and cell replacement therapies, embryo research holds out the promise of cures for many serious diseases, such as diabetes and Alzheimer's. Much progress was made in the private sector because humans are ambitious. In our book, Teaching the Nature of Science, by Douglas Alchin, he says on page 30, science is a human endeavor and it is conducted by and for real people. Research is fueled by sheer curiosity and the desire to improve the human condition.